Good evening, Hunter families. My name is Megan Kelly. I am the school nurse here at Hunter Elementary. I am here during virtual school every day to 8:30 to 3:09, so you can reach out to me. My contact information is my email is mekelly, MEKELLY, at philasd.org, and I have a phone number that can be used during virtual school. It's 267-607-3299. You can text or call that number, and that'll come right to me. So some of the announcements that I have is kindergarten. Welcome to Hunter Elementary. I can't wait to meet you all face to face. There are some requirements for kindergarten. All kindergarten students are required to have a current physical and a dental exam. So if you've had those in the past few months or you're going to get it in the next month, please forward me those documents. You can scan and email it to me, or you can take a picture and text it to me. Just make sure that the picture is nice and clear. Sixth grade students, I know I've saw you in the last 2 days. I visited sixth grade morning meeting. Everybody's getting so big, getting so tall. Sixth grade students by the Pennsylvania Department of Education and the School District of Philadelphia are all required to have a recent physical. So that's something that happened in the last 4 to 6 months if they had a physical, or if they're getting one sometime during this year. So when you get that physical, you're going to get your height and weight checked, your vision, your hearing, see how well you're growing, and you may get some vaccines at that visit. Because now that you're turned 11, you're eligible for some vaccines. And again, you can forward me those documents to that email or that phone number. Now, those vaccines, should you get them in sixth grade, that's great. They're good for seventh grade, because that brings me to seventh grade. So seventh grade, there are some required vaccines required by the Pennsylvania Department of Education and the School District of Philadelphia to be in seventh grade. Those vaccines, two vaccines, the first one is Tdap. The Tdap vaccine protects you against tetanus, which is if you stepped on a rusty nail or cut yourself with glass, it would protect you from a blood disease. And then diphtheria and pertussis, which are some terrible respiratory diseases, and whooping cough. The second vaccine is the meningitis vaccine. So meningitis is a horrible infection of the tissues of your brain. So this way you are protected from that. So those are required. Now there is an extension until November 2nd. So you have until November 2nd to get those two vaccines. You will not be able to return to school face-to-face if you do not have those vaccines. The district is planning on excluding students who are not up to date on their vaccinations. So if you get those vaccines, please forward me the information again. I've reached out multiple times to different parents via text, via email, Google Classroom Streams. I've emailed your children. So there's only about 13 people, so we can do this. Let's get these vaccines together, okay? The last few things that I have is every year you are required, and we are required, to update your health history information, your child's health history information. So it's usually a form I send out at the beginning of the year. It's usually green, because green's my favorite color. And it comes back to me, and it lets me know who's emergency contact for your child, what any diagnoses your child has, any health issues, do they wear glasses, are they taking any medication, and then it gives permission on that form to give your child Tylenol or ibuprofen during the school day. So this way it eliminates a lot of back and forth. Someone comes in with headaches, a young girl comes in with menstrual cramps. We can take care of this and get them back to instruction, which is what we want kids to do, right? Stay in school. So that form is now available electronically, and I'll have the link posted for you as well. The link has also been posted to your child's Google Classroom stream. So you can look for it there as well, and I'll post it again this week, and we'll see if we can get it posted to this video. So medications brings up another thing. So I have a fair amount of students that use their inhalers for asthma during the school year, and then there are some students that have to take medication during the day. So I am not allowed by law to administer any medication to your child unless we have a form called the MED1. That form needs to be completed by the provider who prescribes the medication, and it must come with the medicine. You can't send the medicine one day and send the form 3 days later. I'll wind up sending the medicine back to you. They must come together. So if you are thinking that your child is going to need to take medication while we're in school, now is the time to make those appointments and get permission, get the forms. You can get a form from me. St. Christopher and CHOP use their own forms, and I accept those as well. And then you can send, as soon as we go back to school face to face, you can send the form and the medication in with your child, and we can get started right away. The last thing is that when we do return to school, school's going to look a little different. But we've all been practicing some measures for the last 6 months and getting used to them. And one of the things that we're getting used to is wearing a face covering. So in this state of Pennsylvania, it is required that students wear a face covering during school. If you have a child or a student that is unable to wear a mask for some reason, usually some sort of medical reason, during the school day, then what we would need from you is something called a mask exemption letter. So that's something to get working on during the month of October. Maybe you need to make an appointment with the primary care provider and have a discussion. And if that's the case, the primary care provider can write me a letter that says this child cannot wear a mask during the school day or face covering because whatever, so that I keep that on file. And that's really it for me. So like I said, you can reach me on that phone number and that email. I'm here every day. Reach out to me if you have questions or concerns about your child, or if you need help navigating something in the healthcare world, let me know. So have a good day. Can't wait to see everyone. Thanks.